One of the most common reasons for patients to be referred to my clinic is for a condition that is called carpal tunnel syndrome. In this video, we are going to just briefly demonstrate the exercises that you can do that may potentially help symptoms of carpal tunnel syndrome. So I did explain in an earlier video, but just for ease, I'll recap. So the median nerve travels underneath the carpal tunnel into the hand. It gives sensation to this part of the hand and motor function to some of the small muscles, but primarily this one. When the nerve gets compressed in the carpal tunnel, it can lead to numbness and tingling in the hand. And initially, those symptoms will mainly occur at night. And that's because often the sleeping position can add compression onto the nerve. As the condition progresses, it may then affect activities during the day, and eventually it can cause weakness in the hand. So when it comes to the management of carpal tunnel syndrome, it can be conservative or surgical. This conservative management is divided into two parts, and that will be wearing a splint, which I'll demonstrate in another video, and doing what are called nerve and tendon gliding exercises. So the principle of these exercises is to encourage the natural movement of the nerves and tendons through the carpal tunnel. And it's thought that by doing this, it may help to reduce some inflammation around the nerve, and in that way can help with some of the symptoms. Now, I will say in terms of the evidence for this, it is quite limited, and these exercises may give partial relief of your symptoms. They're definitely worth trying. We'll demonstrate them now. You'll see they're very simple to do, but if they make your symptoms worse or don't help your symptoms, then there's really no need to do them. So we'll start with the nerve gliding exercises. So Sophie's going to demonstrate here. So she'll start with her hand in a straight position like this, and we'll just count down 7 seconds. Then she's going to extend her wrist backwards, and we're going to count for 7 seconds. She's then going to move her wrist backwards out this way, and we'll count that for 7 seconds. She's then going to extend out her thumb, and then she's going to turn her wrist around and pull down on her thumb. So they're the nerve gliding exercises, and now we'll just show the tendon gliding exercises. So she's going to start with her hand in an upright position like that again. Then she's going to make a hook, then a full fist, then she's going to do a tabletop, and then a full long fist. And then the last exercise I'll show, now this can be done with your hand up against a wall, but if you keep your hand straight, and then Sophie's going to pull on her thumb and that part of the hand, and the idea being that you're stretching one of the ligaments in the carpal tunnel. So, and again, just hold that maybe for 10 seconds or so. So, like I said, these exercises may not make an enormous difference to your symptoms, but they're worth knowing about, they're worth trying. But in the next video where we'll demonstrate the splints, you might get a bit more benefit from that.